Hi, everyone, and welcome. I am so glad that you all are joining us this morning. As Melinda said, my name is Hannah Halpenny. So a little about me, I am a forensic nurse examiner. What that means is that I care for patients who have recently been hurt by someone else. I care for patients who have recently been victim of sexual assault, intimate partner violence, strangulation, human trafficking, and other kinds of abuse. So because of my patient population, I am exposed to a lot of trauma. So I am going to talk about vicarious trauma today. My objectives today are that you will be able to define vicarious trauma and compassion fatigue, know the warning signs and risk factors, learn how to protect yourself against vicarious trauma, and explore the positive response to your patient's trauma. So, what is vicarious trauma? It is a workplace hazard for those who work in healthcare and with victims of trauma. Trauma can mean either emotional or physical trauma. It occurs when one internalizes another person's trauma or secondary trauma and experiences the emotions as if they personally experienced that trauma. Internalizing trauma means that they allow this other person's trauma to become their own when one takes on their patient's trauma. This occurs through repeated exposures to others' trauma, whether by hearing the patient's stories of assault, caring for patients immediately following a traumatic injury, having to deal with frequent loss or resuscitation. And it can even be through reviewing patients' charts and reading about trauma. This repeated exposure overwhelms one's ability to cope with the trauma. This occurs when someone, often due to a lack of knowledge of vicarious trauma, allows their empathy to be uncontrolled, allowing them to be open to internalize and ruminate on this trauma. Allowing your empathy to go uncontrolled can cause you to become too inserted into the patient's situation. Even something as simple as mirroring a patient's facial expression can, over time and with repeated occurrences, build up to vicarious trauma. I know I have a tendency to mirror other people's facial expressions, so I'm just cognizant when I'm with my patients to have an empathetic and listening facial expression, but not to reflect their same expression. Because vicarious trauma requires repeated trauma exposure, eventually all of this trauma will build up and cause the healthcare professional to view their job and eventually their life with a negative lens. The signs and symptoms of vicarious trauma are similar to that of post-traumatic stress disorder in that there are both physical and psychological symptoms. These symptoms typically affect the person both at and outside of their job, although the cause of the trauma is their job. Someone suffering from vicarious trauma may experience physical symptoms like an increased startle response, fatigue, decreased energy, insomnia. They may have psychological symptoms such as nightmares, anxiety, constant worrying, being easily distractible. They may have irritability or a short temper, and they may have intrusive negative thoughts. Those suffering from vicarious trauma will have difficulty empathizing and an inability to deal with stressful situations. These psychological symptoms of vicarious trauma may eventually lead to conflict between the sufferer and their coworkers or loved ones, causing strained interpersonal relationships. Related to their job performance, they may have decreased energy or motivation, leading to less work efficiency or poorer job performance. They may make errors and they may have frequent ill calls. Their work satisfaction will be negatively affected as well. And finally, all of this vicarious trauma will compound until it causes a change in the person's worldview, causing them to feel like there is no purpose to life, and they may be overcome with pessimism, cynicism, or hopelessness. There are multiple risk factors that may predispose a healthcare professional to developing vicarious trauma. The first and most significant risk factor is providing frequent care for victims of trauma. This would include many of you, licensed mental health practitioners, social workers, personnel in the emergency department, the intensive care unit, or the rapid response team, EMS personnel. Really any field where you are either going to be exposed to the patient's emotional or physical traumas during many, if not most, of your days. Having a personal history of trauma may predispose one to internalizing their patient's trauma, comparing their own trauma to their patient's trauma, and experiencing a traumatic response. Having post-traumatic stress disorder, anxiety, or depression can add to this risk factor. Secondary trauma can also exacerbate the symptoms of PTSD and anxiety. Now, having these conditions does not mean that you can't work with patients experiencing trauma. It just means that you need to be aware of the signs of vicarious trauma. Be aware of yourself enough to recognize when you may be developing signs of vicarious trauma or its precursor, compassion fatigue, and have a personal plan for self-care to help prevent the symptoms of vicarious trauma from developing. Lack of a good support system, whether it be lack of friends and family or lack of support at work, can lead to a person bottling up the trauma that they take in every day without having another person to lean on. Poor coping skills at baseline, such as avoiding one's feelings or unhealthy coping mechanisms, such as using substances to cope, are risk factors in that the person is unable to appropriately cope with taking on another person's trauma repeatedly. If you work with patients experiencing trauma, you need to be able to have healthy coping mechanisms in order to process and deal. Work-related risk factors for developing vicarious trauma include feeling overwhelmed with one's workload, having few days off work. It could also be performing the same tasks repetitively at work, whether it be menial tasks that don't provide much satisfaction, or it be repetitive traumatic events such as a string of resuscitation or losses. And lastly, compassion fatigue, and within that, burnout, is a major risk factor for and component of vicarious trauma. So what is compassion fatigue? Compassion fatigue is an emotional fatigue that results in numerous physical and psychological symptoms that affect a person outside of work, although it is less severe than vicarious trauma. Compassion fatigue is a combination of secondary trauma, which again is when we're taking on the trauma of someone else, and burnout. People are predisposed to compassion fatigue by being empathetic, which sounds like most of us, right? But it's also through having poor professional boundaries. If a person becomes over-involved in the emotional well-being of their patients, they can become emotionally exhausted. In one case study, a nurse spent any free time she was not performing her nursing duties by being at her distraught patient's bedside, providing emotional support. She did this for hours on end, for days, until she eventually developed compassion fatigue. She dreaded work. It affected her interpersonal relationships. While it is important that we have our patients' well-being in mind, we must also know to protect ourselves and understand that we cannot expect ourselves to be our patient's only support person. This is an infographic to illustrate how these concepts are related. So burnout is specifically emotional exhaustion related to work. A person experiencing burnout will experience dread going to work. They will have a negative attitude regarding work, but it will not yet affect their life outside of work. When there is a buildup of secondary trauma on top of this negative attitude with work and dread going to work, it becomes compassion fatigue, and the symptoms start affecting their life outside of work. When these symptoms affect the person so much that it has changed the way they view the world and their life, it is vicarious trauma. There are several signs and symptoms of compassion fatigue that are the same as vicarious trauma. The primary difference is that there is a fundamental change in the way one views the world with vicarious trauma. The physical symptoms of compassion fatigue are fatigue, difficulty sleeping, headaches, stomach upset. Someone with compassion fatigue may experience mood swings, depression, anxiety. They may have difficulty empathizing with their patient. They may start using unhealthy or ineffective coping strategies, such as turning to substances to cope with their stress, like drugs, alcohol. They may even start using nicotine. With compassion fatigue, someone may start isolating themselves from others, which will only exacerbate these symptoms. With compassion fatigue, someone may very likely have a lack of satisfaction with their job or their life. However, this is just the beginning stages of vicarious trauma. The person will not yet be completely pessimistic or hopeless, but if left unchecked, their compassion fatigue will eventually turn into vicarious trauma. So how can we protect ourselves against vicarious trauma? The first step to preventing vicarious trauma is knowing about vicarious trauma. So you're partway there. If someone isn't aware of the possibility of vicarious trauma, they may allow themselves to over-empathize, leading to them feeling too concerned with the patient or feeling too connected to the patient's trauma. Understanding the dangers of being too connected to your patient's trauma and then protecting yourself by controlling your empathy helps to prevent vicarious trauma. It is crucial to maintain professional boundaries when working with patients. Instead of empathizing with patients on a personal level, which can lead to the transference of secondary trauma to the healthcare worker, one should control their empathy and refocus on the patient's health and safety. Being able to be compassionate, caring, and trauma-informed while maintaining professionalism is an important skill as a healthcare worker and is important to protect oneself against vicarious trauma. Instead of mirroring your patient's emotions, try reflective listening, telling your patients, "I hear you," validating their feelings, building their strength. It's not only one way to protect yourself from being personally over-involved, but also is more therapeutic for your patient. Protective work environments are those that have supportive leadership and teamwork among the patient care team with adequate staffing. As I said, one of the risk factors is having a lack of support. So feeling that you have supportive coworkers is a huge preventative factor from becoming overwhelmed with the trauma. Adequate staffing is helpful as it allows one to care for each of their patients in the way they feel is to the best of their ability, which helps to ensure job satisfaction, general satisfaction, prevent burnout. And lastly, debriefing after traumatic events is a huge mechanism to prevent vicarious trauma. Debriefing following challenging events helps to prevent vicarious trauma by encouraging all staff involved to acknowledge the event, learn from the event and from each other, and appreciate the work that each member of the team did. Debriefing allows for all involved to reflect on the event and begin the process of healing and resilience. Because of this, it is best to hold a debrief within hours of the event. It is crucial that everyone involved in the debrief be aware that the opportunity is for growth and healing and not chastising or reprimand. It is critical that there be no finger pointing or blame during a debrief. The basic structure of a debrief is to discuss the facts or timeline of the event, celebrate what went well, discuss what could have gone better and why. It's important to have a debrief leader, such as the coroner, charge nurse, chaplain, your supervisor, someone who can help to guide the discussion, provide individual and group feedback, and summarize the main learning or takeaway points from the debrief. The process of debriefing may also help to cultivate teamwork by helping those involved to bond and appreciate each other. And if you are a Methodist employee starting this December, Methodist and women's hospitals will have the RISE program, or Resilience in Stressful Events. This program has specially trained peer responders who can be called if a staff member is experiencing a particularly difficult or stressful event at work, who can help the staff member to cope and work through the situation. Talking with a RISE peer responder is confidential, so don't be concerned about anyone else being aware of the situation. Outside of your job and the workplace, self-care is key. The best way to take care of yourself and thus staving off burnout, compassion fatigue, and vicarious trauma is by having work-life balance. You need to leave work at work and utilize your free time for yourself. Have hobbies, be active, take a bath, cook. Ensure that you get adequate sleep, exercise, and eat healthy. Focusing on your overall health helps you to be mentally healthy. You can also take care of yourself mentally by journaling, meditating, or praying in order to help you process your thoughts and feelings. Appreciation is also important to stave off compassion fatigue and vicarious trauma. Showing appreciation for yourself, to acknowledge the wonderful and important work that you do. Appreciation for your daily life, and appreciation for your support system. Outwardly expressing your appreciation leads you to internalizing that positivity that is in yourself and your life, and it brings positivity to those around you. Talking about your mental health with a professional is a huge protective factor against vicarious trauma. Talking to a mental health professional can help you to build strong coping strategies, help you gain other perspectives of your stressors, and help you to work through difficult events or emotions. If you don't know where to start with finding a licensed mental health practitioner, most employers have an employee assistance program or an EAP through which you can access a mental health practitioner for low or no cost to yourself. I recommend speaking with your supervisor to find out more about your employer's EAP. And last but not least, take your paid time off. I know I'm admittedly not the best at this, but it is so important to take time away from the workplace and to refresh. Even if you just have a staycation, you're still spending some me time away from the workplace. And you can use your time off to refocus on your self-care strategies that we just talked about. So you may notice the signs of vicarious trauma in yourself and start implementing those self-care strategies to help mitigate those symptoms. But you may also notice them in your coworker. You may notice your coworker is calling in sick more than usual, or their usual bright and happy personality has become more negative. Just as you would with your friend or family member, you can help them by talking with them privately about what's going on, talking with them about their work-life balance, encouraging them to practice a healthy lifestyle. If maybe you aren't particularly close with the coworker, you can just say, hey, I don't know what's going on, but I'm here to listen if you want to talk. You can tell them about EAP, or you can encourage them to talk to their supervisor. Their supervisor will be able to get them connected with the appropriate resources and help to build their resilience. So with all these negatives I've been talking about, you're probably wondering, why do most of us even do this work? I promise you, there are positives to providing this care. It's possible to have a sense of fulfillment instead of taking on secondary trauma when caring for these patients. Compassion satisfaction is the feeling you get when you feel you've made a difference in your patient's life, that you're doing good work, and that your work brings you fulfillment in life. This can be achieved by focusing on the little things. Every time a patient or family member says thank you. Let me tell you, even though some days are hard, I experience such satisfaction whenever a patient tells me thank you or expresses that I helped make dealing with their trauma a little easier. To achieve compassion satisfaction, one must focus on the positivity that their work brings to others, in addition to having a strong support system around them, and having a positive attitude about work. Compassion satisfaction will help a person to be excited about coming to work and feel a sense of achievement in their day. It will positively affect mood, job satisfaction, and can even positively impact depression and anxiety. I feel compassion satisfaction with every forensic nursing patient I care for because I know that I did the best that I could for that patient, that I helped them to understand the medical legal process and assisted them with their coping and resilience. But to reach this, I also focus on cultivating my support system and intentionally coming to work with a positive attitude. Another positive of working with patients in traumatic situations is vicarious resilience. This is a concept initially recognized by Hernandez, Gangse, and Engstrom in 2007 when they were interviewing multiple psychotherapists who described their patients as heroes. This term, opposite of vicarious trauma, is taking on our patients' resilience and internalizing it. Seeing the strength and power in our patients can positively affect us and in turn give us strength and resilience. Vicarious resilience comes from a pattern of recognizing resilience within patients and drawing positivity from that. This is why providing trauma-informed care and helping your patients to recognize their own strength is not only great for your patients, but also for you. While compassion fatigue and vicarious resilience may co-occur just due to the nature of caring for patients who experience trauma, having an awareness of all of these concepts is imperative. Being aware of the many different responses to others' trauma can help you to recognize when you need to intentionally cultivate your resilience and decrease internalizing of secondary trauma. Just like vicarious trauma comes from repeated exposures to patients' trauma, vicarious resilience is gained through repeated exposures. So consistently using your trauma-informed skills and building up your patient's strength will rub off on you. And how do I build my patient's strength? So a portion of my medical forensic exam is to have the patient recount their history of the assault that brought them in. This is necessary because it helps to guide my assessment and know what injuries the patient may have sustained. However, this can also be incredibly difficult for the patient. Phrases I often tell my patients after their recounting of their history include, "Thank you so much for telling me that. You are so brave. You are strong. I am so proud of you for coming here today." So here are the main things that I want you to take away from today. The best way to prevent vicarious trauma is by knowing about its signs and symptoms and recognizing the early signs of it. The initial precursor to vicarious trauma is burnout. This happens when one starts feeling overwhelmed and emotionally drained from their job, typically associated with a dread with going to work. If someone is also frequently exposed to secondary trauma alongside burnout, they can also develop compassion fatigue when they start experiencing these symptoms of stress outside of work. Once someone has a total shift in their worldview and start experiencing general hopelessness and pessimism in their life, then they are suffering from vicarious trauma. To prevent suffering from vicarious trauma, it's imperative to practice self-care strategies, employ a firm work-life balance, get lots of sleep, spend time with your loved ones, build up your support system. Having someone to lean on and talk to is so important. If you notice the symptoms of burnout, compassion fatigue, or vicarious trauma in a coworker, then you can help them by letting them know that you support them, or you can refer them to your supervisor. And lastly, I want you to know that caring for patients during their acute trauma is not all bad. You can have positive responses to caring for these patients. Compassion satisfaction is when you experience fulfillment from the work that you do. You can help to cultivate this fulfillment by building up your patient's strength, which can cause you to experience vicarious resilience. Thank you.